What to do when you have dry eyes? Millions of people worldwide suffer from dry eyes. More women than men and elderly persons than younger people are affected by this ailment. Chronic dry eyes, CDE, also known as dry eyes, DER, are closely related to how much tears the eyes produce. You should be aware that tears are not water, though. In addition to water, tears also include lubricants, minerals, and electrolytes. Every time we blink, the tear film lubricates, moisturizes, and cleans the surface of our eyes. This substance gives the tear film its stability. For some patients, dry eye symptoms may only be transient and infrequent, but for others, they may be severe and concerning. Common signs of dry eyes include eye dryness, an itchy, burning sensation, a gritty sensation, as if there are sand particles in your eyes, an increase in light sensitivity, intermittent fuzzy vision. Despite how strange it may sound, some dry eye patients may suffer from excessive tearing. In the first instance, insufficient degeneration is what leads to the dry eye situation. The eyes are unable to produce enough tears in this situation to moisten the eyes. The tears that are produced in this situation are quality with no quantity and are healthy but very scanty. This type of dry eye is more typical. Another instance of dry eye is when the components of the tears are lacking. In other words, the tears are devoid of their organic makeup or content. The eyes generate enough unwholesome tears, quantity with no quality but in sufficient amounts. Due to this deficiency, tears lose their ability to bind to the surface of the eyes when we blink and instead swiftly wash away to the bottom part of the eyes, dehydrating them. The cycle then repeats as more harmful and excessive tears are produced. Patients with dry eyes in this situation will suffer teary eyes. There are a number of things that can cause dry eyes over time, which are hormonal changes. These occur frequently in women during menopause and pregnancy. Poor health, diabetes, high cholesterol, thyroid problems, cancer, etc. The body's aging process, which causes degeneration in most body parts, including the eyes. Negative side effects and prolonged usage of specific drugs. Eye inflammation. This may have impacted the tear gland, the gland that produces tears. A few specific medical procedures, such as chemotherapy and radiation for cancer patients. Environmental condition, long-term, continuous, unprotected exposure to adverse environmental factors such as heat, sunshine, poisonous chemicals, or gases. According to some medical experts, using a computer might lead to dry eyes. That is untrue. The fact is that extended computer use may induce temporary dry eyes, not chronic dry eyes, as a result of the eyes' reduced and infrequent blinking caused by their continual attention and hyperfocus on the screen, discussed on another page. Even while using a computer does not cause chronic dry eyes, if the disease is not treated with eye drops, it could get worse. Dry eye that persists untreated. The good news is that it is manageable, despite how annoying this may seem. Many over-the-counter eye drops are available for dry eyes. If you have one, your eye doctor should suggest it to you. When tests are conducted and a patient is diagnosed with dry eyes, the usual eye drops prescribed are formulated to provide the complete components, which are the aqueous, mucus and lipid layers of the tears as much as possible. These lubricant eye drops have been clinically proven to reduce both the signs and symptoms of dry eye, quickly, providing immediate, long-lasting moisture and protection. So, the patient no longer has to suffer through burning and irritation due to their dry eyes, and they get temporary relief with these lubricant eye drops.